next question that I want to ask is around de-addiction. So you run a de-addiction center, and in a rehab, the environment is such that people can recover easily. वो environment ही उस तरीके का होता है जिससे कि हम addiction से बाहर निकल सकें. And a lot of times addiction का एक बड़ा reason environment होता है. आपके triggers होते हैं, आपके environment के triggers होते हैं. So जब कोई रिहैब सेंटर से रिलीज किया जाता है, हाउ डज द रिहैब सेंटर मेक श्योर कि वंस दे आर बैक टू देयर लाइफ, देयर नेचुरल लाइफ, नॉर्मल लाइफ, तो वो दोबारा से रिलैप्स ना करें? हाउ डज वन टेक केयर ऑफ दैट?
Yeah, it's a good question, Soumya. And I think when the patient comes out of de-addiction center, we need to psycho-educate the family members and the patient himself about whatever are the causes which can lead to further relapse of that substance. So we need to identify those causes or triggers. Until unless you identify those triggers, you're not going to, how will you know that what is causing that thing and how the person is able to cope with that? So you have to increase his coping mechanism to those triggers. Like I'll give you an example of triggers. There may be people who have a time-related cue, time-related trigger. Evening time, for example, most of the people, alcoholics, I've seen, they get a trigger in the evening time because they have an addiction of taking alcohol once they come out of their business work, or when they come out of that shop or from office, or they want to take alcohol because that's an evening cue for them. Now, if you really want to help them, you have to fill up that gap of alcoholism by some other thing. So, for example, if he goes to play badminton instead of playing drinking alcohol, or he goes to play a guitar, or maybe he goes to for a running, that thing can be, that empty space can be filled up. Otherwise, what will happen? You have stopped the alcohol, but that person is craving for that empty time. Something needs to be done, that missing thing, and he will get into some other addiction. And because one addiction stopped, another addiction will be there. So you have to fill the gap with some healthy addiction. Otherwise, the person will get relapse. Second thing, there are other cues, like the people who have difficulty in saying no. We call them lack of assertiveness. Assertiveness is something which prevents you from addiction. I've seen people who are totally, teetotaler. The best quality I've seen of them, they are sometimes they don't think about what other person is thinking. They say, no, I don't drink. You cannot make me force drink. They're very strict about themselves, and that is the reason, because they don't drink or they don't go into any kind of addiction. Problem with people who are too much of they have a problem with assertiveness, and they don't want to make other people feel bad. What will they say? They will accept, okay, it's okay, I'll take it. I can take it once. Okay, today I'll take, but next time I'll not take. So this will keep on continuing, and because of this lack of assertiveness, they cannot say no, and they don't want to drink themselves, or they don't want to go into addiction but other people will force them into addiction. This is the problem of the personality of the person. The lack of assertiveness is another thing which is causing problem. Then third thing is any kind of cues you can identify. Cues mean the triggers which can cause the person to go back to addiction needs to be addressed. For example, if the person is having fight with the wife and he goes back to alcohol, so the fight needs to be clarified, or the therapy needs to be done between the husband and wife, and their idea the conflict needs to be resolved. If you don't resolve the conflict, what will happen? He will take the excuse of that and keep on taking alcohol. But the coping mechanism of that person should also be increased, that any kind of these things can happen. If you are into a life, there will be problems happening day to day. None of the people will have an absolute normal life. Whatever economic position the person is having, he will have some kind of troubles coming up and down. So one needs to have a healthy coping mechanism to come out of addiction. If you have an unhealthy coping mechanism, that problem will not get resolved. Another problem, addiction, will also continue in that. So that needs to be addressed. Then fifth thing is healthy activities needs to be practiced to them. A routine should be focused, like an activities of daily living should be practiced regularly on the basis which needs to be done inside the hospital also and outside also. And he needs to be in a discipline phase of that. If he's going to discipline phase, possibilities are there that he may not go back into addiction. But I'll always tell you, until unless a person gets something which gives him a better kind of addiction and healthy addiction, there are high chances that these addicts will always go back to addiction, because they will always keep seeking those things. These addicts have a personality of seeking something. Something is missing in their life, and they want to fill it with some kind of blocks. That blocks needs to be put in the right way so that they don't go back into addiction. And that is the purpose